Hi, my name's Tivoli. I am a therapist with a private practice in Lexington, Kentucky, and I know that the process of finding a therapist can be really difficult and time-consuming. Some people don't even really know where to start. So today, I'm going to walk you through some of the basic things you need to know when looking for a therapist so that the process of finding a therapist that's a good fit for you is a little easier. There are a lot of different kinds of therapists, and therapy can look incredibly different depending on the therapist that you choose. So when you begin the process of looking for a therapist, it's important to ask yourself what you want out of therapy. If you're seeking therapy because you want to find a solution to a problem or develop coping skills to better deal with the problem, you probably want to look for a therapist who practices some kind of brief therapy, such as solution-focused brief therapy or CBT. These therapies are focused on finding solutions to problems, and therapists who practice this way are often more directive, giving you practical tools to deal with whatever you're dealing with and make it better quickly. If you're seeking therapy because you want to gain insight into why you feel and act the way you do so that you can address your issues at the core, a depth-oriented therapy would probably be a better fit for you. A few examples of depth therapies are psychodynamic, existential humanistic, Gestalt, psychoanalytic, and Jungian. These types of therapies often explore patterns of thoughts and behaviors with curiosity around their origins. The idea is that when we're able to gain insight into why we engage in certain thought and behavior patterns, we'll realize our power and ability to change these patterns. This kind of therapy generally takes much longer than brief therapy, but often results in longer-lasting improvements. So to give you all an idea of what this might look like in the actual therapy room, we'll pretend you're looking for a therapist to address the social anxiety you're experiencing. A therapist who practices brief therapy would help you change your thoughts about how others perceive you and develop anxiety-reducing skills or behaviors. So think relaxing breathing techniques or self-affirmations. While a therapist who practices depth or insight-oriented therapy would help you explore the origin of your social anxiety and dig into some of your beliefs around how others perceive you. Deep-seated and long-held beliefs will be challenged, and new perspectives will be presented and explored. I wouldn't get too hung up on the different theoretical orientations of a therapist because most therapists integrate many theoretical orientations into their practice, so it's likely that a therapist would say they practice both brief and depth therapies. Therapists often tailor their theoretical approach to what they feel is the best fit for their client, and many times this incorporates elements of both brief therapy and insight-oriented therapy. The two guidelines I will give you when thinking about theoretical orientation are, if you know for sure you don't want to talk about childhood trauma or your relationship with mom and dad, don't go to a depth or insight-oriented therapist. And if you want more than just tips, tricks, and skills to better cope with what you've got going on, don't go to a strictly solution-focused therapist. So here's a visual to help you all get an idea of some of the theoretical orientations that fall under brief therapy and some that fall under depth therapy. Mostly coping skills is brief therapy, and mostly insight is depth therapy. There's overlap, and it's not cut and dry, but hopefully this comes in handy somewhat when browsing therapists' theoretical orientations. Now that you have a better idea of what kind of therapy you want, it's time to figure out how you're going to pay for it. I know most people who have insurance want to use it because you pay an arm and a leg for it every month, but there are a lot of factors to consider when deciding whether you can or want to use your insurance for therapy. Most people who aren't therapists aren't informed about the benefits and limitations of using insurance for therapy, so I wanted to bring them to your attention so you can make an informed decision about how you want to pay for your therapy. Obviously, if you don't have insurance, you're going to have to pay out of pocket for therapy, but with this, you have a couple options. You can either pay the therapist's full fee if that's something you can afford. You can talk to them about a sliding scale where they can give you a reduced fee in order to meet your financial needs, or you can utilize an HSA or an FSA account if you have one of those and use your pre-tax dollars for therapy. On the other hand, if you do have insurance, you'll need to determine whether or not your insurance will cover the therapy you want. So you'll need to go back to the primary reason you're seeking therapy. If you're seeking therapy because you're hardly making it through the day and life is super unmanageable, chances are you'll meet criteria for a mental health disorder. This is something insurance will cover if your plan covers mental health care. In order for insurance to pay for your therapy, you must receive some kind of mental health diagnosis. If life is pretty manageable, but you're wanting to go to therapy because you know things could be better if you put some work in, insurance isn't going to pay for this. Self-improvement and personal growth are not considered medical necessities and therefore are not covered by insurance. You can try to use your insurance for this, but it puts your therapist in an awkward and ethically sticky spot where they either have to tell you they're unwilling to give you a diagnosis because they don't feel you meet criteria, or they have to stretch the truth a little to prove to your insurance provider that you need this service. If you think you might qualify for a mental health disorder and are considering using your insurance for therapy, one thing to ask yourself before you decide is, are you okay with a mental health diagnosis being on your permanent health record? A mental health diagnosis could disqualify you from life insurance or cause your premiums to be higher than what they normally would be. It could cause you to be denied from the military or security clearances, and you could potentially be treated differently by health professionals or whoever else has access to your medical record because of the diagnosis you've been given. If these are concerning to you, you may want to avoid going the insurance route, but if you're not worried about these things, insurance may be a great option. If you want to use your insurance for therapy, you'll need to find out what kind of mental health coverage your insurance plan provides. To do this, you can call the number on the back of your insurance card and inquire about coverage. Some insurance providers don't cover any mental health services, so if that's the case, you'll need to pay out of pocket for services and leave the insurance company out of it. Some insurance providers require you to reach your deductible before they begin paying for any part of your therapy. So if this is the case, it's important to know what your deductible is and whether you think you're going to meet the deductible at some point throughout the year. Many people are on plans with super high deductibles that they never meet, and these people may be better off choosing to not use insurance because their insurance most likely won't be kicking in anyways. Some insurance plans only require you to pay a copay, and they pay the rest when you see a therapist, and this is usually when it's most beneficial to utilize your insurance. Ask your insurance provider what your copay is for counseling services so that you know what you're getting yourself into financially. Another thing to be aware of is that some insurance plans will cover a portion of out-of-network care. Ask your insurance provider if you have any out-of-network benefits, as you may be able to get reimbursed for part of your therapy cost, even if your provider doesn't accept your insurance. Your therapist will need to provide you with a super bill or a receipt of services to send into your insurance company for reimbursement, and this is something that most therapists are willing to do if you ask. Okay, so you know what kind of therapy you want, and you know how you're going to pay for it, so now we get to the fun part, looking for a therapist. Psychology Today is a great place to go to find a therapist, as the majority of therapists are on this site. For that reason, I'm mainly going to focus on Psychology Today's features, but I'd also like to give a shout out to a new therapist directory site called Therapy Den, because the search options are a lot better than Psychology Today's in my opinion. There aren't nearly as many therapists on it yet since it's new, but it's a wonderful site that's focused on social justice and inclusivity. So if you're looking for a therapist who's especially open to minority groups or oppressed individuals, this is a good site to check out. If you type in counselor, counseling, therapist, therapy, any of those words in your city and state, chances are Psychology Today will be one of the first sites listed, which is why most therapists are on this site. If you look at the search tools, you can filter therapists by specialties, approaches, gender, faith, ages they work with, insurances they take, languages they speak, and sexualities they're comfortable working with. Filter out therapists based on what's important to you. If your sexual identity is important to you, make sure you find a therapist who's affirming of that. If you want someone of the same faith, filter for that. If you're struggling with a specific issue, look at who specializes in that in your area. If you're looking for someone to help you develop skills to better deal with life's obstacles, pick someone who seems competent and sounds like they know what they're doing. If you're looking for someone to help you explore the depths of your soul, pick someone you think you could connect and be vulnerable with. This is the fun part. Be curious and shop around. This is a huge decision. You're about to choose someone to walk with you on your journey of becoming a happier and healthier you. If you're unsure about whether a therapist would be a good fit, ask them whatever questions you need answered so that you can feel confident about going into your first session. Therapists know that first sessions can be really scary, and most are willing to do a short phone consultation or at least answer any questions you have via email to make you feel more comfortable with beginning therapy. If a therapist doesn't get back to you after you reach out to them, they may not have enough time in their schedule for new clients. Don't let that discourage you. There are lots of options. And if you had a first session with someone and it didn't go well, you don't have to go back. You're allowed to try out therapists for good fit, and you don't need to feel committed to the first one you try. Best of luck on your journey to find a therapist, and if you're in the Lexington, Kentucky area looking for an insight-oriented depth therapist, I might be your girl. I don't accept insurance, but I have a sliding scale fee schedule to accommodate clients who can't afford my full fee. You can find out more about me on my website at tivoligardenscounseling.com, and don't hesitate to shoot me an email if you want to know more about what therapy would look like with me. Thanks.